we created something that takes away from us the very essence of physician and very essence of patient. And so if you want to get back and create again the right relationship between physician and patient, it's beautiful. It's absolutely beautiful. You don't have to treat the symptom. You don't have to treat even disease. You don't have to treat even the person with the disease and symptoms. What you need to do, you need to provide the best environment for the body for self-healing. And this is how you have to approach the patient. From the time that you see the patient coming to your office, you observe the patient, and you make your preliminary diagnosis. When patient sits down, you have already diagnosis done, and then you start to talk to the patient. And if with this interaction you didn't find the true root of the problem, then you can examine the patient. And when you examine the patient, you have to know exactly what you're doing and why. And then if you're not sure about the diagnosis, then you send this patient to the test. But you will not send this patient to the test if this test will not make any difference. The first HMO that I know was in China, 3,500 years ago. And it works like that. The medicine man was going from one house to another house in the morning. And outside of the house, it was a vase. So he would reach into this vase and take the coin, put it in the pocket. It means that everybody is healthy in this house. And he would go to next one and to next one until he'll reach the coin and it's not there. So it means that somebody's sick there. So he has to go and treat this family on his own time and on his own money. So his incentive is that everybody's healthy. If I want to practice medicine, real medicine, the first thing I have to address is the relationship. I want to be an advocate for my patients. I want to keep them healthy, happy, safe. So, and that is why I have to use my innovative mind to create something new and beautiful in the middle of the disaster. In 1 hour of the first visit of the patient, I learn about this patient much more than anybody of his relatives or the physicians who saw him before knew about him. So this relationship is the main thing. And in the new style of the medicine, I think that we have to address this issue of wrong relationship between everyone. So if we'll be able to reestablish these relationships, to reestablish this feeling of good, warm, loving family, then it will be golden. Today we live in an incredible time when we get the crisis. And usually people address this crisis something bad. For me, crisis is great. I have the child in the office with the parents, and all of a sudden this child has the temperature, fever, and doesn't feel well for several days, and all of a sudden in the middle of my examination, child threw up. And so I'm very happy because I know that this is crisis, and from this point it will be better and better. The old system thrive on very interesting paradigm that disease is permanent and health is temporary. And the new system that I am envisioning is that health is permanent and disease is temporary. So it's totally different approach. You were born healthy. What is the reason for you to have disease? It's because something all along we don't do right to our body. One of the biggest problems that we have today in society is depression. And it's not deficiency of Prozac. We don't have deficiency of medicine. We have deficiency of good relationships. We are a bunch of egoists, and we have to admit it. You know, when you go to AA meeting, the first thing, My name is John and I'm an alcoholic. So now we have, as a nation, as the humanity, we have to stand up and says that my name is John and I am an egoist. So I want everything for me. And I want more and more and more. We consume a lot. We overeat. We overconsume. We have too much of dress. We have too much of everything. Our cars are the biggest car in the world. We have to have all of it. So the interesting part is that, which puzzled me, that the richest people, the most successful people, more often end their life with the overdose of drugs. You take Hollywood and you take their stories. What do they need? They have all the money in the world. They have all the fame in the world. And everything is great. They have palaces, not the house, palaces, helicopters and everything. And yet, drugs. Not Prozac, but street drugs, right? So instead of giving Prozac today, you have to relearn how to communicate with other people, how to be happy with little. And I can tell you a story. In this chair was a lady, Hispanic lady from Dominican Republic, very obese, came to me to get out of the loop. She had diabetes, high blood pressure. She had a bag of medications, and she is very unhappy. 3 of these medications is for depression. So I took her blood pressure, and her blood pressure was 200 over 110, and her sugar was very high. And she's sitting there, and I offering one thing and another thing, and I see that she's not responding at all. So I looked at her and I said that, you know what, for the longest time I want to learn how to dance merengue. I was wondering if you can teach me. With arthritis, with obesity and everything else, this old lady stood up, and she was with the translator, and the translator started singing and started clapping. And this lady, big lady, she started move like, I don't know, so elegant, so great. So, and she was dancing there. And of course, you have doctor who don't know how to dance, and his movements like not the movement that supposed to be. And we were dancing for 5 minutes, maybe 10, I don't remember. And then she sit down, and she was smiling like a baby. I took her blood pressure. Her blood pressure was 140 over 90. Can you find any medicine that can bring this blood pressure so fast without any side effects? What we need in the society, we need happiness. We need to be who we are, not who the society wants us to be. We want to be successful by the means of society, but not who we are. And I would say that we are in a crisis, and today, to survive this crisis that we're getting in, we have to invest to 2 things. It's not your gold, it's not your silver, it's not real estate. 2 things only. It's your health and relationships. These 2 things will get you through.